Welcome back. Is your neck hurting? If so, this is the video for you. I've got 3 exercises. These are 3 of hundreds of exercises that are available to my channel members. And if you want access to all of the exercises, become a member for only $5 a month. It's less than a cup of coffee. But if you have any type of neck pain, what's gonna happen is oftentimes, unless you had direct trauma to the neck, it's gonna be the joints below or above that are responsible for the neck pain. That's gonna be the thoracic spine and the upper cervical spine. At the thoracic spine and upper cervical spine, they are designed for mobility. If you lose mobility in the thoracic spine or upper cervical spine, the lower cervical spine is gonna have to compensate by becoming more mobile and losing its stability. So to build up that mobility in the thoracic spine, one terrific exercise is going to be the foam roller horizontal. We could use something like a foam roller, obviously, and then what we would do is just place it on the ground adjacent to the spine. From this position right over here, we would go ahead, place it to the segments where we've lost that mobility with our hands. We're gonna grasp behind our head. We're not yanking on the head. The hands are just there for support. What we would wanna do is inhale, lower ourselves down to the ground. Once we can't go any farther, exhale, and just naturally allow ourselves to sink deeper. We're not forcing it, just allowing gravity to work. So we inhale, lean back, exhale, and that is the foam roller horizontal. Next, we want to build up some stability in the lower cervical spine. For that, we can do the extensor chain wall lean. This is one of my favorite exercises to use with my physiotherapy patients. What we would do, if you don't have one of these, you could use a towel, or you could even just do it right up against the wall. This is just gonna make it a little bit more comfortable. You would place the yoga block on the wall. From your ear all the way down to your ankle, you want to maintain one straight line. You don't want to go into excessive flexion of the spine. You don't want to go into extension. Make sure that that chin is tucked in, the chest is pressed out, and you're maintaining a nice vertical line. You want to keep your mouth closed, swallow. When you swallow, the tongue should be stuck up against the roof of your mouth, and we're going to hold this position for 3 minutes. After 3 minutes, you can come out, and that's gonna be a terrific exercise to help build up that stability in the lower cervical spine. And then for the upper cervical spine, what we wanna do to bring back that mobility is some chin tucks. A lot of people, because of the way that we always live, we're either at our desks all the time, we're eating in this position, driving in this position, we're on our phones. What we'd wanna do to counteract that is do some chin tucks. So we would go ahead, drive that chin in toward our throat. You know you're doing it if your voice sounds funny like this, and then relax. So tuck that chin in and then relax. Do that to help build up that mobility in the upper cervical spine. And if you want some more custom solutions to speed up your results, go ahead and send me an email.